The information in this video is for educational purposes only. It is not intended to diagnose or treat any specific medical condition. Use of this information is not a substitute for advice from your physician or therapist.
If you have pain from trauma or severe pain from an unknown condition, please be evaluated by a physician before continuing this video. This video is not designed to address that type of pain. So first, what is pain? Pain is your brain signal to your conscious self that some tissue damage is happening or about to happen. Like you have sprained an ankle, you fractured a bone, that you cut yourself, that you're getting too close to the fire. These are signals that your brain sends to your conscious self that pull away, stop, some tissue damage is about to happen. Now that's good and appropriate response. I use the term harm to describe the appropriate pain due to tissue damage, as opposed to the term hurt, which describes that annoying, uncomfortable sensation, that painful condition, but there's no clear tissue damage going on. Now, when there is harm or the tissue damage pain occurring, we need to stop or modify our activities and give our tissues rest to allow it to heal. Unfortunately, when we have hurt, it is a real true sensation of pain and discomfort, but we can't find any active tissue damage occurring, or there has been some tissue harm, but the healing should have occurred. Now, why does our brain and our nervous system send us these incorrect signals? Well, for an example, I'm going to hold my arm up here, and I'll come back to it in just a moment. The most common reason in my sports medicine clinic that I see for hurt is muscle imbalance, which is a mix of muscle fatigue and muscle tightness. Now, I'm going to come back to this arm here. Now, if I held my arm up here for the next 5 to 10 minutes, eventually I'm going to have some muscle fatigue. It's actually going to hurt and become uncomfortable. But holding it in this position for 5 or 10 minutes is not going to be causing tissue damage. But it will be uncomfortable. So it will hurt, but there'll be no harm occurring. Now, how do I fix this painful condition? Well, obviously I will take my arm and I will lower it in there. And in just a few seconds, or maybe a minute, the discomfort in my shoulder should go away. So I solved the problem of muscle fatigue and muscle tightness by lowering my arms. Now, this was a very simple example in a very isolated case. But imagine if you have groups of muscles that are tight, other muscles that are weak and fatiguing, and now they all mix together to create this muscle imbalance across your spine, across your hips, across your shoulders. It's going to be painful. It's going to be annoying. It's going to be hard to describe, but it's real. That's muscle imbalance. So how do we treat these muscle imbalances? Well, the priority is a mechanical treatment, like my exercises on Dr. Rob Rehab. These are designed to improve muscle balance. Now, you can also do physical therapy, Tai Chi, yoga, Pilates. I'm all for those as well. And I also advocate for hands-on treatment, such as massage therapy, myofascial release, and spinal manipulation. These modalities can help to assist in improving your muscle balance.